typically what I would do now is I would think about finding out, breaking this down more and starting some exposures with these. But I think I would want to, in the interest of time, I think I need to move on with other related topics. Okay, so, and in the interest of time, we can either talk first about parents, or I think we can talk about the parents, which is actually pretty easy, and then do and then talk about the cognitive stuff. Is that what you want to? Is that okay in terms of the sequence? Okay, good. So, yeah. Can you pass these? I mean, again, these are all in your handouts in that workbook that you have on DVD. So, but just so you see, sometimes with the younger kids, what we do. As I told you, in my right now, I don't think you have enough for everybody. Just share among the table. We do with the in one of the. Sometimes it is helpful to get the parents involved. I told you I'm doing a research study, really studying that more carefully, and because a lot of these parents are encouraging avoidance behavior and not encouraging doing things because they are, quote, overprotective, sometimes a more systematic approach to their parenting can be helpful. Okay. Do you notice how I phrase things? You're never going to hear me say you must always get the parents involved. I'm going to say sometimes a systematic approach to the parents can be helpful. And that's where you need to use your judgment, clinically as to whether or not getting the parents involved will facilitate, or whether or not getting the parents involved, if anything, will just make things so much worse, because, and you have to think about it. And is it better to try to just expedite things with the child alone? But if you're beginning to feel that the parent is sabotaging things and is too overprotective or too controlling, sometimes a systematic approach can be helpful. And on the contract that's written there, in case you're wondering, it says STIC because that's in the manual. I mean, STIC actually is a term from Phil Kendall's Coping Cat. It stands for Show That I Can. So it's basically, all these exposure tasks and all these things that we ask them to do, it's referred to the kids as a STIC task. Show that I can, show that I can do that. So that is Phil Kendall's acronym, which I think is a nice thing to use. But again, this is in the manual. So, and so a lot of times once we have and this is more with the younger kids, with the teenagers, you may not necessarily need to do the contracting as much, but sometimes with the kids, because they're so anxious and they're so afraid, to get them to do certain things, it's sometimes, and because that these parents sometimes themselves have a hard time in doing things, because a lot of times you do need the parents to transport the child, to do certain tasks, etc. So something like this, let it be known that on this Tuesday, the 24th of May, a contract between, Jamie and Mrs. Smith concerning the child's fear of being was signed. And then you notice how specific it is. And this is a good contract, and this is true when you do behavioral parent training as well. This is the, 15 minutes. It doesn't just say stay in the Dayland Mall. It says for 15 minutes. And then she'll stay up an extra, and it doesn't say she gets to stay up late at night. It says an extra half hour, and it doesn't say whenever. It says on Thursday night. And it says that and it doesn't say the kid can do it whenever. It says it has to be done on Thursday, and it doesn't say the parent can give the reward whenever. It says on Thursday. Okay, so it's a very, very specific approach and detailed approach. Now, as I told you, the manual I gave you was the individual manual. In the parent training manual, which I am happy you know, you guys, when anybody who gets rich from any of this stuff, don't forget, you know, I'm joking. We already decided at the beginning that we all trust each other. So if any of you would like that parent manual, I can send it to you, because in that parent manual, we have even a workbook. I gave you the individual workbook. We even have a workbook that involves, you know, I didn't want to flood you with all this stuff, you know, and I didn't want to give you stuff that you're not going to use. So only if you really need to use it. But if you want the parent thing, it's not a problem. I can even get the center to put it on DVDs, and I can do that. You have to realize all this stuff was happening last minute, and getting all this stuff together was hard. So I can get the parent manual and the workbook, because we have, like, the contract, like what I handed out is in the workbook, and we also have a reward list, you know, and how do you make the rewards, and talking about different types of rewards, tangible rewards, non-tangible rewards, activities, and kind of explaining all that, okay? You're going to help her by allowing her to do these things. And as she does these things, she will learn that she can do these things. And you will learn that she can do these things too. Does that make sense?
It makes sense, but you know, she really can't do that unless I'm there.
I understand that's how you feel, and that's why you're in this program. No, I mean that's my thought bubble. No, that's my thought bubble. That, you know, and I understand, and this is exactly why we do try to get you involved in this, because as you see Polly doing these things, you might be really surprised. She might do much more than you think she can do.
Okay. I'm willing to give it a try.
I believe she can do a lot more than you think.
Okay.
And a typical mom will either say okay, or they will keep saying, I don't think so. I don't think so. I mean, that's part of the parenting. We talked about the overprotectiveness and the negative, you know.
She cannot do it. She cannot.
So, but that's why you need to say, well, I think she can do more than you think. And as long as they understand, so, and then I might even say, like I would say, so could you, I just want to make sure, because this is a really important concept, this idea about the protection trap. So could you explain it back to me, please, Mrs. Gibson?
Yeah. So I'm going to try your way. And when you give Polly an assignment, I'm going to not help her. Let her do it on her own.
Okay, is that what I said? Not help her? I mean, I want to make.
No, that's what I thought you were saying. I thought that's what you were saying. That so I was explaining that everything that.
Wait.
I was explaining that everything that Polly can do is because of me, because I'm there with her, and I walk her through it, and I say the right things, and you know, and my husband does as well. And you're saying now that we should not do that.
What, so I'm going to explain it again.
Okay.
What we're asking you to do is to allow Polly to try the things that we're asking her to do in the program, and allow her to do that, rather than stopping her from doing those things.
Okay.
And if she does those things, she'll be more likely to learn that she can be away from you.
Okay.
And the bad things she thinks will happen to you won't happen.
Okay, I understand.
Do you?
Yeah.
Okay.
Do you
And
want
I
me-
understand this is going to be hard, and it might take a little bit of time, but you know, we'll keep practicing it and talking about this, because I understand that this is difficult.
Yeah, it's really going to be hard.
It is. It is. And that's why we're here to talk about it. What did you guys think? Yeah, I want comments. Yeah. Let me just ask Linda first. Linda?
I was wondering if parents ever say, you mean let them cry?
Yeah.
You know, they'll cry.
Yeah.
If I let.
And
Should I
then,
just let them
and the answer is, well, you know, what we're going to do is we're not going to have them do anything that's too difficult for them. And if it's getting out of control, then we'll stop doing it. The message here is mainly allow the exposures to occur, and don't protect them from not doing them, because you know this. Yeah, and that's the main thing, and getting them to cut that behavior. And you know what? with the contracting, it helps because the contracting is also forcing so when you do that contract, it's not just a contract for the child, it's a contract for the parent. Because the parent is agreeing to allow that exposure. And so it doesn't explicitly say, but it is really implicitly a contract for the parent as well. So, but I have to give you a thing. 1 second. Yeah. Polly. And it is, I have to say, some of it is a little bit like teaching. I mean, like when you heard my style, it was kind of explaining, say it back to me, and then I say, well, that's not exactly what I said, let me say it again, and then I would probably say it. And, and sometimes initially I think you were very realistic because you didn't buy into it right away, and a lot of parents are not going to buy into it right away, and sometimes I'm not going to lie. Sometimes the parents don't buy into it and they continue, but all you can do is keep giving this message. And at some point, if the parent is continuing to be that way, at some point you have to like probe it a little bit more with the parent and say, I wonder what makes it so hard for you to let this thing continue. We talked about the protection trap, and sometimes separation anxiety disorder is theoretically in the DSM a child disorder. But it isn't. And we, in my current study, we're not doing it, but in a previous study, we used to assess separation anxiety disorder in the parents. The study that I talked about on Friday, that other study I talked about the other day, and we do find that many of the mothers themselves have separation anxiety with the child, and it makes them anxious to be away from the child, and sometimes it then just can't translate it into their own partners in life. So you are, the point is you may be dealing with a more serious pathology in the parent. It's not just parenting, it could really be something, and sometimes you need to deal with that. And if you're not ready to deal with it, then you need to refer the parents sometimes to get some assistance themselves if you're not able to offer adult therapy for someone. I mean, I'm talking about the extreme case where the mother is clearly like, but I personally find that if you do this training the way we talked about it, and the mothers start seeing the successes. Do you remember the main point I made on my presentation on Wednesday? As the children started changing, the parents start lightening up because she thinks that her child needs her. She thinks it. But as she starts seeing that her child is making progress and is doing okay, she goes, oh, I'm okay. Now, sometimes you're right. It can make the mothers, and I do believe that when the mothers start resisting or dropping out or whatever, it's because they don't want that taken away from them, and that gets into the more complicated clinical issues. It's not psychodynamic. It's just it's an attachment relationship issue, and the mother needs, and then you start wondering, well, why is the mother only so invested in the child? And then it might mean issues in the mother's own empty life that she needs to find, a partner or something else, take up painting or something, So, but I'm just making the point that I'm just giving you the clinical, pictures of what can happen. But many, we've been working with the parents. The kids are getting better with the parents, without the parents. Most of the parents, you do this type of training, you do this explanation, because they don't see because most of them believe what I'm doing my job. My kid is upset. I'm taking away my kid from being upset. Now you're telling me to make my kid upset? What do you mean? And then it seems so counterintuitive to tell a parent, you running and encourage and telling them everything is going to be okay is actually not in the best interest of anxiety reduction. Any other, you had a question? Yeah.
I'm wondering that, thank you for the technical support. I'm wondering if when
the mom starts resisting, if you, because she even mentioned, which is pretty common, oh, you don't even know how she was like a year ago. It was much worse. So I'm helping her to bring the impairment issue and why she is there. Why did she bring her child anyway? Like, you know, I know you're helping, but it sounds like they will reach a point where.
Well, I mean,
You know,
sometimes, you know, what we
kind
do, I think what Vera asked is like, I think what you asked is, does it help to remind the parent about the child's anxiety issues and how is the anxiety interfering and talk about impairment and, yeah, I mean, that's always, yeah, yeah, and it might be helpful. And that's why I did say we're here to help you, and we know it's hard. Now, and the other thing that also comes up is because the parents a lot of times have their own anxiety, it gets hard for the parents, and this relates to the parents' own anxiety and their own pathology. And then the parents are also in a bind, because then the parents are thinking, so I would say, so it's hard for you, I understand it's hard for you, and our instinct is to want to protect our child. I understand that. And I also understand that we might feel anxious ourselves about that.
Well, for me, it's just more that she gets upset.
Okay. Now, I'm going to like twist it to get more into this idea. And this actually raises another issue, I think, Mrs. Gibson, which is how should we behave as a parent when it comes to our own anxiety? And do you have any ideas on that?
Well, now that you just said that, I do have an idea. I mean, I didn't have it before just this moment.
Maybe talk loud.
Well, now that you just said that, I do have an idea because I can see how I overreact. You know, she gets so upset. I mean, sometimes I cry with her.
Right.
But now I think you're saying that
I'm not sure you're acting.
So good. Oh, I'm a child clinical. No, I'm a child clinical psychologist. So I'm just playing some of my parents.
You're very good.
Thank you.
But this is a very realistic. So right now we've got Elizabeth running as for the Academy Award. We got this one running for the Academy Award, and at the end we're going to figure out. We're going to vote who should get the Oscar.
So I was just saying that now the way that you just phrased that, I understand what you mean. Because before I would cry with Polly sometimes, or I get so upset and overreact, my husband would say. But I thought it was important for me to show her that I felt her pain.
Right.
And I am upset when
Right.
she gets that upset.
Right.
But now I see what you're saying, that I have to try to calm down.
Right.
But it's hard to do that.
It's,
She gets
it's
so
very,
upset.
it's very hard. It is.
So how do I don't know how to do
Well,
that.
but well, part of the things that we're going to be teaching Polly, you can also learn it. You know, you can go. You know, we have the handouts, and you can ask Polly to explain to you what are some of the things that she's learning in the treatment, and you can learn from that as well. Because most of the things we're teaching the kids is done with adults as well. But I want to just mention something about how you talked about how you cry sometimes yourself. And I just want to talk about something, because a lot of times it's really confusing to parents about how to behave. And so, and now what I'm about to say to the parent really depends on their educational level, for example. So because, you know, and I might pitch it differently depending on the educational level of the parents. But like, how many of you in this room, I mean, you know about, like, you know, I've heard about like the Bandura Bobo doll experiments. Raise your hand if you know about the Bobo doll. You know about the Bandura experiments, or the modeling experiments. Okay, no, some yes, some no. Okay, you know, it depends on the parents, but you know, a lot of people know about those experiments. But even if they don't, what I usually say is that, you know, there was a famous psychologist in the 1960s. His name was Albert Bandura. And he did some really interesting experiments. And I know this might sound weird, but I think parents sometimes like to know, like, there's like some facts from this. So and this is like really, you know, if you YouTube this, you can YouTube these experiments too on the internet. And I say, you know, he did these really famous experiments where he had kids, had kids in fearful situations and being scared of things. And sometimes the kids watched a model where the model was always brave and always strong and never showed any fear. This is not actually the Bobo experiments, but it's still Bandura, by the way. It's still Bandura. And sometimes the kids would watch other kids in fearful situations, and sometimes the models they were watching were always brave, you know, never showed fear, Mr. Macho. And sometimes they had the kids watch these films of models where they were kind of like scared and a little apprehensive, but then they managed it and they handled it, and they showed the model doing this successfully. Which of those models, and this is an experiment, and then there was a, you know, another control condition, you know. Which one? If you had to take a guess, do you have, this is real, and this has been replicated many, many times in psychology experiments. Which model do you think helped the kids the most in terms of helping them to manage their own fear?
Probably the brave one.
Okay, no. Why do you think the brave one? Okay.
Well, because I thought you were telling me this because you're saying that I have to be more brave and I
Right.
have to not.
I understand. Most people would think the brave one. Most people would think the brave one. As parents, we think we need to be brave. We think we need to show that we're in control. They look to us. But actually, watching people deal with life and dealing with the daily worries and anxiety can be helpful.
I'm so confused. So I thought you were telling me that, well, I shared with you that I sometimes cry with Polly, and that Polly gets so worked up, and I get so worked up, and my husband gets mad at me because he says I overreact. And I thought you were agreeing with my husband and saying that I need not to do that. But now you're saying that I should be this way?
I can get myself out of this, but I would like to see if someone else wants to get me out of this. Who wants to volunteer to get out of this? Thank you.
Is there somewhere in the middle? I mean, you don't have to not react at all.
Yeah, make sure it's loud, Mary.
But is there some other place? I mean, is there another option you can try other than breaking down at the same level as your daughter or being who you really aren't?
Well, I'm here to try whatever options you think I should try. I'm just confused as.
So I'm here because I realize Polly needs help, and I'm willing to try the options. I'm just confused as to what you're trying to teach me right now.
So is there a way to model, yeah, you're right to be upset, but there's a way to handle it?
I mean, I guess I could just say that. I could tell Polly that she's right to be upset and ask her what she can do.
How do you show it? Because this is really more a matter of you showing, because she's going to maybe take a look at you, like take a look at the model of the movie, and she's going to learn from how you handle it.
Well, maybe I could show her that I care by, my facial expression and my tone of voice, but just try to hold back the tears, like what you're saying about being in the middle. Like maybe not overly show, but show her that I do care and that I feel her pain, but also try to stay calm. Is that what you're saying?
Yeah, it is. Could you do that?
I could try.
give it to her or someone, because I have.
She got one. So, I mean, I think what I was trying, I mean, that was a little bit, that was a little bit, you have to use your judgment. I mean, usually parents actually get this idea that it's more useful for a child to watch a parent gradually learn to handle their own stresses and problems than to always feel like they have to be in control. And that was the point I was trying to share, because it was good, okay, thanks. and I think, Joe, I really like the way you said, is there something in the middle? Because it's not black and white. It's not like you always have to be macho, and it's not like you got to be an emotional wreck. And there is something in the middle. And I think it's important, because then sometimes parents need to learn, well, you know what, maybe I really can't do this, and maybe it is time for me to do this, because it's not a useful thing for children to see their parents having breakdowns, but it's also not good for children not to see their parents expressing emotions. And there is a happy, healthy medium, and I think that's kind of the message. I mean, without getting too much into the details, I think it's just a lot of times all we're doing in these sessions, don't get me wrong, we're not trying to do everything and change everything. We're just educating, and we're just planting seeds. That's how I feel. We plant seeds, we say a few things, and you know what? She may not get it right away, but you know what? Maybe 6-7 months later, I remember when Dr. Silverman once told me that there's something in the middle. I'm serious. Sometimes that's what happens. It doesn't always happen right away, but sometimes at some point the mother might say, gee, I kind of remember that, and I wonder if this is a time for me to start thinking about the middle. So anyway, so that's an important point, because a lot of times parents, you need to educate parents about how they should be serving, what kind of models they should try to strive to be. Are there any other questions about that? Yeah, the mic, please.
Thanks. Just before we leave from parenting, I just wanted to know, is there any kind of scale or anything that you use to just determine, for separation anxiety, I think it's pretty clear that parents are always going to be involved in treatment, but for other anxiety disorders, it's not always clear right in the beginning. Like in the ADIS, I don't think there's really specific questions for parents to see, whether or not they're enabling. So that's one question. And then the other one was just, once you determine, or whether parents should be involved, in your manual, is there, are there specific parent sessions where, how is the structure of the manual,
in my
I guess,
structure, because
with
it's a
parenting?
research study, we're having the parents and children together in the sessions, and we're working on the cognitive behavioral stuff.
In every session, the parents are there?
Yeah,
Okay.
in every session, the parents are there, and they're learning everything the kid is learning, and on top of that, they're learning they do the parenting stuff. So that's how we do it. But in terms of what the parents, separation anxiety, clearly the parents play a big role, because a lot of the tasks involve, okay, this week you're going to leave the house for 30 minutes. Next week, next week you're going to go out for an hour, 2 hours. I mean, that's, that might be some separation anxiety tasks. But even with other anxiety problems, like social anxiety or even specific phobias, anything, a lot of times, there's this term in the literature, it's called safety, a safety signal, a safety. And sometimes kids can do certain things only because they believe their parents are there with them, even if they don't have separation anxiety. So for example, even if you have social anxiety, like some people with social anxiety might say, I can't do this. But if my mom is there, I'm okay. Now, is that separation anxiety or social? Well, that's where it gets, if the mother leaves, now help me out with this, I have to think about this. If the mother leaves and the child is still able to, help me out with this, because I wasn't prepared to go here, but if I'm able to speak in public, if I'm not able to speak. But then I can do it when my mom is there. But then when my mom leaves. Huh? What?
And you can't speak in public.
I cannot speak in public. Right? Exactly. Okay? Exactly. Exactly. So what happens, and it's not just moms. A lot of kids and adults with anxiety problems, they develop safety behaviors. Now, some safety behaviors are fine. For example, here's a safety behavior. In theory. It's really not, but.
Are you showing your?
My face my fears.
Oh, face my fear. Oh.
This says face my fears.
Oh.
No, this is this says face your fears. And it says CAPP. I showed you this with you yesterday. This is a safety behavior. And theoretically, it's a safety behavior theoretically if I can only do certain things like speak in a group if I have this. But theoretically, it's true that that's how many people with anxiety problems are. They believe that.
That's better than having the mom.
That's the point I was about to make. That's the point I was about to make. And sometimes you need to figure out, well, some safety behaviors, that's okay, that's cool. In fact, it's kind of like a way to cope and handle. But it's still, my attribution is, I cannot do this without this bracelet. But it's okay, because, what the heck, it's, But with the mom there, it's not. And so sometimes part of what you need to do also I'm answering your question, you also need to figure out if the parents are they serving that role, and does it then need to be explained that, let's try doing some of these things without mom present, okay? Because sometimes, and so you might need to have them do things with mom and then without mom.
Are there any questionnaires with parents?
Oh, yes, a ton of questionnaires. Ton of questionnaires. If you want questionnaires, I'll give you questionnaires. Okay. Any other questions? All right. I know we handle it quickly, but you got the gist of it, right? Okay. So finally, BCT. Finally, there is cognitive work, and as I said, some people emphasize it more than other people. When people think about cognitive strategies, they usually think about self-control training and coping. They think about changing self-talk, and they think about problem solving. So what do we mean by self-control training and coping? So when people think about self-control, they usually think, and I didn't make this up, this is coming from a long time ago in the literature on how do you teach people to stop smoking? How do you teach people to lose weight? How do you teach people to do lots of things? And a lot of it is first you have to control yourself when it comes to when it comes to eating or smoking or drinking. It comes from that literature. And so what's the first thing you need to do? Well, the first thing you need to do is you need to observe and pay attention to your own behaviors. And you don't just stick the first thing in your mouth that you see, or you don't get anxious, immediately. So it's first observing yourself and paying attention to yourself. And then only after you've stopped and paid attention to your behaviors, only then are you in a position to actually be able to change it. Because most behaviors are very automatic. We just grab that thing that we see in front of us to eat, or we get scared and nervous, just out of the blue. So first we have to observe it, and then only then we can start changing it in terms of modifying the behaviors, the thoughts, and the talk, and then we can, reward ourselves with self-evaluation and reward. Now, at FIU, we developed this acronym, and I only brought you the yellow balls. But I have pens that have stop signs on them, shaped as a stop sign. And then we have, pads that say stop. So we kind of like make stop kind of, one of the logos of the program. Because as I say, most people, usually anxiety just comes. It just comes, that's what people think. I just get nervous, I get anxious. They don't know all the situations that are actually eliciting it. So the way we teach self-control strategies to the kids is through STOP, which is that. First, recognizing when you're scared. And that gets back to the tripartite assessment of anxiety that we talked yesterday. How do you know when you're scared? You know that you're scared by the, the tripartite things. Our thoughts, our behaviors. And so that's how we know that we're scared. Okay? Then we talked about how we're going to focus on changing the behaviors and the thoughts and sometimes the feelings in our body. So we talked about what it feels like to be scared, and we're going to help. And another thing is, when you're scared, we have certain things that we say to ourselves. And typically, and this is all in the manual, and typically you might start off with a neutral event, like, let's say it's a birthday party and it's time and it's your birthday. What would be some of the things you might say to yourself? And we're not going to go through it because the kids, and blah, 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 okay? It's my birthday, I wonder what I got as a present, all that. But also, but there's also, and then say, okay, now, but when you're needing to be away from your mom, and you get those feelings in your body, and you don't want her to go away from you, I wonder if there's certain things that you're also thinking about. So why don't we do it as a group exercise, a group role play. So, and you know what this is? Do you know what this is? Have you ever seen something like this? Yeah, what's that? Yeah, like, cartoons. You ever read cartoons? Like, what cartoons do you like to read? Snoopy or something? Garfield, okay. So, what are some of the things you might say to yourself when your mom isn't around you? What if I get sick? And I would have the kid write it. What if I get sick? Okay, what else? I'm going to get lost. I'm going to get sick. I'm going to get lost. Yeah. What if? And honestly, these are real things. Kids are saying these things. This is what separation anxiety. What if she doesn't come back?
What if something happens to my mom? Yeah, we've heard that. What if something happens to her?
What if something happens to her? Okay, and you want to give me one more? What if she forgets? Okay? And I would, and that could take you 15, 20 minutes. Might even take, 30, 40 minutes, it depends. And if the child's not able to give you any, then you should, and I think the manual has like some, hypothetical ones, like let's make believe, I think it has a dog, a dog. Here's a child who's afraid of a dog. Or here's a child who the parents, I think it has something to do with the parents being late and picking the child up, and what might the child be thinking, like my parents are not going to, so there's some examples of I'm just saying if you can't get the child, there are some hypothetical examples that you can give. But then, okay, so these are the thoughts that you have. And you see, they happen so quickly, but now what we've done is we've stopped and we've actually realized that these things are coming so fast, but if you actually really stop and think, this is what you're thinking. And you remember earlier in our 2 meetings ago, we talked about the thoughts and the feelings and the behavior? Do you see how that is? And these are some of these thoughts that are making you feel nervous and then making you want to be away from your mom. Do you remember that? Okay, so these are the thoughts. So now, and by the way, I play a lot of hangman with the kids. So I would not even present it like this. I mean, because remember I said you got to make everything fun, 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 right? So what I would actually do is I would say, we have this acronym, and I would actually play a game with them. So I would say, okay, and the other and so we did S, and well, this, but I might, I'm just saying I might do O, and I might say, what do you think? I would try to get them to guess it, but I don't know if you can do it now because it doesn't work. They already have S and T, so they're not so stupid, right? They can get the O. But I'm just making the point that you do things self-discovery. But so I say, okay, other things. So now O stands for other thoughts and other things you can do. And notice, that's why I'm not a straight cognitive therapist. It's other thoughts, but it's also things you can do. Because I do believe that there are a lot of coping behaviors that kids can do beyond just thinking about things. So what are some other thoughts or other things you can do? So let's just, can you erase that? So tell me, what are some other thoughts or other things? These are what you're thinking now. What are some other thoughts or other things you can do? Speak loud.
I could remind myself that
Mommy always comes. Mom always comes. Okay, what else?
Send her a text and see if she's coming.
What's that?
Send her a text and see if she's coming.
Okay, but that's a safety behavior. And by the way, though, we've had to control that sometimes. Yeah, no, we've had to control that, because sometimes it is part of the anxiety. But it's hard now because that's what I said yesterday about the generation of kids. What is all this stuff going to do? Because people can't be can't be alone for a minute, or a person can't be late. It's like even with regular people. It's like after 5:01, I'm here. Where are you? It's like so. It's not anxiety. That's just the world of texting. I'll be there. It's 4:59. I'll be there. Okay, yeah.
I have that special handkerchief I can put in my pocket, and when I start to feel mom's not coming, I can just remind myself that, she gave it to me, and it will remind me that she's thinking about me.
That's something I can do. Yeah.
If it's a young enough child.
Yeah, talk loud.
If it's a young enough child, they,
Yeah.
whichever adult is in charge will stay with me till mom comes. So
Right.
they'll always be an adult.
So go to Miss Liz.
Right.
Okay, that's good. So other things you can do, and yeah.
Distract myself with something fun to do.
Right. Do something fun. Do something fun. Okay. So, so the idea is that, part of this is helping the kids to recognize these thoughts, and that there are these other thoughts and other things they can do, and they come in handy. But again, I think they come in handy when you're doing the exposure work, because then when you do the exposure work, you can go in and do the exposure, then say, okay, these are your thoughts, and what are some other thoughts? And this is a way, like I like to do this after they've done some exposures, because remember we talked yesterday how I think it's hard for them. They can come up with these other thoughts, but I like the idea of seeing after they've done something, they had some success. Well, what are some other thoughts that you had that were helpful? But you could do it either before or after. But I'm just saying, sometimes it's hard for the kids to come up with other things they can do and other thoughts they can have, and sometimes doing it, right after the exposure can help. Does that make sense to you guys? Oh, okay. And here's the example of hypothetically how you teach kids exposure. If you don't want to, if you want to do some hypothetical examples, you can start with this could be the T, the thoughts. The dog's going to bite me and give me rabies and jump on me and get me sick. Other thoughts can be the dog, is kind of cute. The dog, the dog has a collar, so probably doesn't have rabies. If I pet the dog in an appropriate, if I pet the dog, correctly, the dog probably won't jump on me. So these are some, and this is in your workbook. Okay, and this is also in the workbook. Okay, all this is in the workbook on the DVD I gave you, and and you can, you can have the kid fill it out in the session, or you could use the board, my T's and my O's. This is also in the workbook, and I do want to acknowledge Phil Kendall for coming up with this term, thinking traps. I think that was a good term. And some of these examples are his, but some of the examples are ours. And this is also in the workbook, because what we find is you do these exposures, or before you do the exposures, or what is going on with these kids is that they are thinking in certain ways. Remember we talked, they don't have deficiencies, they have distortions. That's what anxious people with anxiety disorders have, distortions. And these are some of the distortions that they have. And it's all explained in the manual, and what we do is we explain to the kids, you know, different people think about things in different ways. And some people, when we work with them here at FIU, they do all of these things. and some of them just do one or two of these things. So again, clinically, you can decide how to do this. You can decide that you see a child who's doing one of these things and you focus on that, but maybe you're seeing a whole bunch of them. What I usually do is I explain all of them, and then, because sometimes it's hard to know exactly what everybody's thinking, but I say, you know, the people, we find that kids and adults too, they think about things in certain ways. And sometimes these are traps, and it's really hard to get out of these traps. And it just keeps us more and more feeling anxious. And what I'm hoping for you to learn is that if you do these things, some of the things that you think will happen won't happen, but you also need to kind of think about how you think about things. Think about how you think about things. So for example, it seems to me that what you just explained to me, Richard, I think what you just explained to me, when you explained this to me, I think you were doing what we call, and I actually have, believe it or not, I have props at FIU for all this stuff. We have toy cookies, and one of them is, you know, all of them are beige looking, and one of them is dark brown. I think what you just did is this burnt cookie. I think that's, do you have any idea what I'm talking about?
No, I don't know what a burnt cookie is. So.
I know. I need to give an example. Richard just told me that, he got everything, and it's related to, no. Yeah, that's exactly right. Exactly, yeah.
Yeah, the negatives.
Yeah, and I was trying to come up with and in fact, this is in Beck's theory. Okay, it's selective abstraction. Let me just tell you what it means, and we'll come up with an example. There's a zillion examples. Selective abstraction, if you're a child, is the burned cookie. It means instead of looking at the whole picture, they're looking at the one thing. Instead of looking at all the cookies, they're looking at the one burned cookie. It's selective abstraction. They're selecting out of the whole one thing. And many kids do selective abstraction. They, instead of making the whole, look at all the great cookies you made, but look, this one is, and by the way, I mean, I don't know about you, but, I remember this has happened recently in my house with, that person I mentioned earlier. It's like, she made this fabulous thing, and then like, oh, it's burned. I said, what are you talking about? Oh yeah, don't you see that one's burned? I said, no, it's not burned. But so anyway, what's an example though of in other examples?
Well, like
but.
I was going to say, it could have been actually your presentation on Wednesday that you did very well when you said you like your cartoons. You're very comfortable with your cartoons. And it shows that you spent a lot of time picking those things out. Now, they weren't in your presentation, and you could have looked at that and said, I had a horrible presentation,
Right, yes.
Everything fell apart.
Exactly.
Just because you didn't
Exactly.
present it.
Perfect example. Yeah, I have to give you a thing on that. Perfect example. No, that would have been a perfect example if I had said to myself that was the worst presentation because I didn't have my cartoons. And somebody would say, but Wendy, they still thought you were interesting and they still laughed at your jokes. No, I didn't have my cartoons. Why you, but look, why you focus, okay? Exactly. So that's selective abstraction. Yeah. So anyway, and kids do that. So, and again, I can talk to the kid and say blah, 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 and explain it theoretically, but I'd rather them come in with real examples, real situations, and say to them, well, what did you think was happening? Well, I thought everybody, my thing went terrible. Well, what's the evidence? Well, I don't, there isn't any evidence. It's just the way they think. So that's selective abstraction, and I like to make it concrete with the little kids by having these cookies there. Okay, and these are all, some of them are variations. They're not all that, some of them are very similar. What do you think what would Richard need to be saying to me to be an example of that? And this is, what is this a picture of? I can't even tell. Oh yeah, yeah, that's Dom. So this is, if someone now says something else to me. Now, and so what I'm doing is, often they're telling me something, and I go, you know what this reminds me of? This reminds me of this picture of these guys with this domino. Do you know what a domino effect is? All right, so what do you think, Richard? Give me some examples of what a kid could be doing that's a catastrophizing domino. And how is it different from selective abstraction? Yeah. If it starts to rain, then the streets are going to flood, and if the streets flood, mommy's not going to come and get me, and mommy's not going to get me, I'm going to get locked in the thing, and then da-da-da. Are we doing this? The group traffic phenomenon, yeah. Okay, and so that's, and so this is all, what we're doing right now is we're doing the T's, and then I hope you understand that then you do O's, you do other thoughts and other things you can think about. All right, but right now, we're doing with actually, now that I realize I should have explained the T's and done this first before I do the O's. But anyway, this is T's. Here's another example of what a lot of kids with anxiety problems are doing. They're doing mind reading. Okay, what do you think mind reading is? What? What do you say?
No, I was just saying, I think he said, he was talking, but I think, projecting what somebody else
Yes.
thought.
Yes, exactly. So they say, I know when I didn't have I did my selective abstraction, then I do my mind reading. I mean, not just that I didn't have my slides and my talk was a disaster, everybody thought I was probably unprepared. They probably thought it was my fault, and they probably thought I was really an idiot.
The girls, I'm sure they don't like me.
Yeah, and so when we have kids like that, and we do have so we have dominoes at my clinic, and we show them the dominoes, and we have a crystal, a fortune crystal ball, like from the Wizard of Oz kind of thing, and we say, what are you, a mind reader? No, what are you, a fortune teller? And then we, but then we explain, like, so let me understand. So you're able to read people's minds? No, that's exactly what we say. I mean, I try, again, depending on the kid, you have to be sensitive. But some kids, sometimes the humor and the sarcasm can work with the kids. Again, you have to be clinically sensitive. But sometimes it's like, oh, so now you're a mind reader? I mean, and I personally think, oh, you're a mind reader is a lot more effective than doing a whole thing than saying, that preachy, talky stuff that we talked about, and preaching to them how it doesn't make sense for them to think that they can know what other people are thinking. Okay, and this that's the mind reader. That's the fortune teller. So that's all right. What's the fortune teller? That's related to catastrophizing, by the way.
Yeah, I'm gonna fail. I got 3 and I'm gonna fail.
No, not that. Yeah, no, not.
The one that you can look into the future and know that
Yeah.
something bad is gonna happen.
No one is going to come to my party. I'm going to have a party and no one's going to come, or what else? What else? Yeah. Yeah. And what else?
I'm not going to get into college.
Yeah, am I going to go? Right, exactly. So, it's like, these things that they think this is going to happen, this and this, and like somehow they can read the fortune. So that's also a good thinking trap that to point out to the kids. Because again, these kids are doing this so automatically. It's so automatic. So for them to be able to see that, that they're doing this and to learn to stop doing it, and it's so maladaptive. Okay, overgeneralizing. So this says, okay, their first report card, this says math B-, and now the second report card, it's a question mark. Third report card is a question mark. But what do you think they're doing? Right, exactly. They'll always get B. Oh, I got a B-, that's it. I'm a B student for the rest of my life. I'm a C. And so that helps to explain, this overgeneralizing thing. Okay? Okay, and this is coming from Albert Ellis, from the rational emotive therapy. All right, the shoulding. I should this, I should that, I should this, I should that. That's just Albert Ellis. He's always against the shoulds. All right, and a lot of the kids, especially the perfectionistic kids, the kids with GAD, I should this, I should that. And it's like, and again, I think it's really effective just to say, you have a lot of shoulds. Okay, and then here's the perfectionism, the A+, the A+, the A+. Right? So, I mean, this is all, and I think these are all really good concepts to be aware of, because you will find that these capture quite well the thinking traps of children and adults with anxiety problems. What Phil Kendall, did, because he's the one that did most of this cognitive work, is that, he took a lot of, these are the things that's in Al Beck, who's the creator of cognitive therapy, and they're coming from his ideas, magnifying, minimizing we didn't do, but but otherwise, this is straight out of Beck's theory, and what Kendall did and what I did, because some of these we created ourselves at FIU, we just took Beck's theory and we put it into a metaphor that kids can understand. And, and it's helpful. It's helpful as you get more evidence from them, as you talk to them more and you ask them, well, what are you thinking? Why do you think that way? And they start saying this, and then you bring out to them, it's a lot of shoulds there. What are you, a fortune teller? And then you get the dialogue going. I mean, you don't just end there, and then you get the discussion going, and you can process it like that.